Dirty Sexy Money Marathon this Saturday starting at 9 a.m. on SoapNet.
Yeah. Delia? Oh, hi. It's nice of you to come by. I know how busy you are.
I just have a few minutes, but there is something that I have to know from you.
From me? What?
I want to know how sick you really are.
Oh, Alicia, I really appreciate you caring about me like that. No, really, I feel much better. You know, I keep on telling them that I could go home, and if Patty takes me home, everything's gonna be fine. Is that all?
Please don't mix up the things that I say. I think you know what I meant. Are you really sick? Were you sick when they brought you in here?
Alicia, I thought you were my friend.
Please don't play act with me.
No, if you think I'm lying, that's bad if you think I'm lying.
I don't know what I think. I just know what I've seen. You know, when I was here with Bob, you were talking about losing the baby, all alone in your apartment, after you'd married Pat. And I knew it was a lie, but you looked so sad, and you made Bob feel so miserable for you that I was sad for you, too. You know, you lie very well, Delia.
Alicia, you promised that...
I promised to keep your confidence, and I tried very hard not to judge what you were doing. But when I see you lie like that, I just can't help but think that perhaps you're not being truthful now.
I mean, why would I lie and then get locked up in here? I mean, that would really be a crazy thing to do. I couldn't do that.
I can't even guess why. Maybe you need attention. But I feel very sorry for you. You need so much attention that you're willing to hurt your brother and your husband so much.
No, you know, it's the doctor. It's the psychiatrist. He's the one who wants me to be here. You know, I keep on telling him I don't have to be here. Now, he thinks I'm sick. No, all right, maybe I was sick and I was terrified. No, what it is I just get a little confused about the baby, and I don't remember when certain things happen, and I just get mixed up, that's all.
Perhaps you pretend to yourself the way that you pretend to everyone else. But it's wrong to make so much trouble for people that love you. I mean, Bob is half sick with worry about you, and Patty's so tired from working and from trying to help you. He could get sick himself.
No, I don't mean to hurt anybody, okay? Maybe sometimes I don't think.
I believe that you think very well, Delia. And if you are pretending, I hope that you see how bad it is, because this is a hospital where sick people belong. There aren't enough beds or enough staff for the ones who need them.
You know, listen to me. I keep on telling them I want to go home.
Well, maybe you should tell them again. I'm going to be late for work. Goodbye, Delia.
Yeah.
Good morning, Delia. I got a message that you wanted to see me?
Yes, yes, I do. Very much. Doctor, I have a confession to make.
Class.
Airplane act.
Airplane.
Well, airplaning is a thing they all do at this age. Ryan did it early. Here. She gets on her tummy, right? But and she brings her head and her shoulders and her arms up and her legs up in the back, right? And she waves them all in the air like this, like she was trying to take off. Looks a little better on her.
Yeah, I'll bet. Well, you sure that that's all right for her? I mean, couldn't you hurt her back?
Oh, no. It's perfectly normal. It means she'll start creeping soon. But it is a sketch to watch. She laughs the whole time. We all laugh back. Your daughter is a real ham.
I never knew they did so much when they were little. Always thought they just sort of sat around like lumps and spat cereal at you.
I knew you had some warped ideas about babies, Finelli.
Anyway, thanks for filling me in on her.
Oh, sure. You have now been officially briefed on her progress from birth to about 7 o'clock this evening. I mean, last evening. Are you aware it must be morning?
I think I broke my watch when I pounded on the pipes. Yeah, sure. Must be morning by now. Huh? Hey, you sure you can't send a message up there?
If I had a tiny pigeon, I would put a note on its toe and direct it to the kitchen. You never did answer my question, Jack. You want to spend some time with Ryan?
Alone, you mean?
Well, I mean, I'll make whatever arrangements you like. Do you want to take her downtown every now and then?
My place, she wouldn't mind.
I want her to know her father. You'd be good for her.
Well, I'm not equipped for a baby. You know, you gotta have special stuff. I mean, high chair or a playpen. And I guess I could get it.
Oh, you don't have to fuss. Just set her on the floor. You might vacuum it first. Put a couple of pillows around. Move anything low that's breakable or valuable.
My mother's antique china.
Well, you might keep an eye on the cat anyway, so she doesn't strangle it. With love, of course. That's all there is to it. What do you say?
I like it. But you don't suppose she'd get confused? I mean, she figures out that I'm her father, you're her mother. We live half a city apart.
Oh, I imagine she'll adjust. Kids sometimes understand these things better than grown-ups.
Yeah. Well, if I do it, I mean, I want to do it right. I mean, I just wouldn't dump her down on the floor and scatter a couple of pillows. I'd rig out a space for her, and then she could have some of her things there, and maybe she'd have something special that she'd only have at her at my place.
Such as?
Well, maybe, electric train.
Huh?
Yeah, train. Yeah, when I was at the Good Shepherd, one of the big department stores would always bring down a electric train and set it up. You know, Christmas time, be nice to the orphans. And, well, they'd set it up for a couple days, and then they'd take it back.
Oh, terrific.
Yeah, well, it was terrific while it lasted. I mean, it was really fancy. A lot of tracks and tunnels, all kinds of stuff. Of course, they wouldn't let us touch it, play with it, but I remember sitting there and watching it go. All right, I'm not kidding now. It had a milk car, okay? It had a milk car. It used to stop at this platform, and doors would open up, and a little guy would come out, and he'd unload milk cans on the platform. I'm not kidding. I'm serious. I can't see electric train this day without feeling unbridled lust.
Oh.
You think Ryan liked something like that?
I bet she would.
Good. Hey, your mother, whoever dreamed this up, they ever considered that she might miss you?
I wish that were true, but she's used to my being away at work all day.
Yeah, I don't mean to criticize, but when do you think you'll be able to spend more time with her? I mean, I think she needs that.
I don't want to miss her growing up, honey, but that means I gotta get this job changed around. What I'd really like to do means less money, but more time. I mean, they could promote Rodney to my job and let me just do specials on a part-time basis. I don't know if they'll buy it, but I might as well try.
Want me to nose around a little for you? I've got some connections.
Thanks. No, thanks. Oh, my dear. Aren't you tired?
No, I'm used to late hours. I used to like to stay up all night.
Advancing age, I guess.
I guess Ryan will be okay downtown. I show her the neighborhood.
Cannoli.
Jumbo. Gumbo hasn't seen her since she was born. Angie and Lou, they haven't seen her at all. Mayor? You, feel a null?
A confession?
Yeah, see, that's the way I would like it to be, but I have to know one thing for sure. Is a psychiatrist like a priest?
What makes you ask?
Well, it's just because I would like to tell you something. Okay, you're the psychiatrist, and I'm the patient. All right, now, if you were a priest, and I told you something, you wouldn't be able to tell anyone else, right?
Delia, the most important thing for a psychiatrist to establish with his patient is an atmosphere of trust. Without that, effective therapy is impossible.
So you wouldn't tell?
No.
No, I mean, you have to promise me that you wouldn't tell anybody. I mean, anybody else, right?
You have my word.
Thank you. Thank you. That makes me feel better. Okay, Doctor. Doctor, I'm a bad person.
Why do you say that?
Well, because I'm a fraud, because I haven't been doing anything real.
I see. You've mentioned that you sometimes have feelings of unreality. Is that what you mean?
No. No, I was talking about the nervous breakdown. See, I made the whole thing up.
I beg your pardon.
Well, I haven't been breaking down. I haven't been going crazy. You understand? See, I felt that Patty was slipping away from me, so I had to do something that I could hold on to him. See, I don't feel as if I should be here. I feel like I should be home. Okay? I don't want to be locked up here anymore.
Let me explain that words like crazy and nervous breakdown, they're sort of slang. By themselves, they mean nothing. They might be used to describe a number of neurotic or psychotic conditions.
Yeah, well, I don't have any of those, so... all right, what I'm saying is, I did this because I was very upset and scared. You got
Okay,
it?
then I think we should be discussing
No,
those feelings.
I don't think we have to discuss anything at all. You don't believe me, do you?
You didn't say that, did I?
Yeah, I know you didn't say that, but I feel like you don't believe me because you don't know what type of a person I am. See, you don't think that I could fool you. Doctor, see, I'm not trying to blame you. It's not that you're not a good doctor. It's just that, see, I studied this a lot. I really know what I'm doing, and I planned this, and I did this little by little, just the way it happens.
Well, wait a minute. You studied how to have a breakdown?
Uh-huh. See, I just checked out all the people who were really going crackers, you know, in books. I mean, you know, emotional breakdowns, checking up on case histories and everything like that.
Medical book?
Yeah, well, I got them right from... Well, you know, Patty has them all around the house. So I just memorized the symptoms. All right, the first one being depression, right? And then I went into the manic phase, and then nightmares, tantrums, and headaches, and then what is it? Numbness of an extremity. That's right. See, so my foot wasn't asleep at all. I mean, do you understand why I had to do that? All right, what I'm trying to say to you is that, Doctor, I have to go home. See, Patty really cares about me, and everything's going to be different. Okay?
Delia, I'm going to have to give this some thought. I want to review your records and...
Yeah, well, I really shouldn't be punished for this. All right, I know I did something very bad, but I promise you it's not going to happen again.
I'll get back to you soon, I promise.
You're not going to tell Patty, are you? Please.
No.
See, Doctor, I'm not really sick, you know, so I shouldn't be here. You have to let me go.
On the
That's
05. Just do it.
you, gentlemen are certainly the picture of gloom.
Is that so? Well, maybe you haven't noticed, Roger, but not everybody is delighted to come and work at this hospital as you are, especially these days.
Well, what did you expect when you went into the medical profession, Bucky? Banker's hours?
Look, just lay off. Will you?
What is it, gentlemen? Why don't you two save it? There's not enough going on around here for you? What is it?
I'm sorry. I'm jumpy today.
It's all right. So are we all.
Well, would somebody please tell me what's going on?
Of course. Being that the interests of the House Association really don't figure into your life, you really wouldn't know, would you? No, you wouldn't, would you?
Well, I am a member of the association.
Yes.
Oh, is that a fact? Gee, that's funny, because we haven't seen you at any meetings lately.
Well, I haven't kept it a secret that I disagree with them in principle on their position.
You got principles, huh? The rest of us don't have any principles. We just, we don't want to work 138 a week because we're just lazy. It has nothing to do with the fact that we're not fit enough to care for the patients, does it?
Well, how are you going to take care of the patients when you're outside picketing underneath their windows?
It's the only way to make this community give a damn about what's happening around here.
Fine. Well, when you're outside prodding the community's conscience, what's going to happen to Angel Nieves, Bill Woodard? You know, Mr. Woodard almost died the other day because he had an anaphylactic reaction. Now, what would have happened if he hadn't gotten immediate care?
Hey, Roger, I see your point, but I want you to understand this. We're giving treatment to all emergency cases and to all serious illnesses. We are not abandoning anyone. And we must keep in mind that our distinguished senior staff will be on duty all the time.
Yeah, those big guns who make the rules but don't have to live with them. They're going to have to come down here and practice little medicine themselves for a change. And you know what? I bet they're just going to scare up somebody to give them that funding really fast.
I suspect that's wishful thinking.
Scheduling doctors to work these kind of hours for this long, that's wishful thinking, Doctor. And I hope the administration sees it.
Well, fine. And I hope that nothing happens to Angel Nieves or Bill Woodard or any other seriously ill patient while you are outside having your official tantrum.
Can't get...
Okay. That's right. Come on. Okay. That's very good.
Great. I can walk halfway across the room if somebody holds me up.
Angelito, you know it's going to take some time.
Time. How much time do you think I've got, Alicia?
Well, that much is on your side.
Sure. I'm going on 13 and I got the rest of my life to learn how to walk. I'm sorry, I just get discouraged. But you're right. I am doing good.
It's okay. I know you feel sad, and sometimes it's better to say so.
No, not when there's so many worries. The money problems, are they bad?
No, we're managing.
We? You mean you? If it's not the money, something else is wrong. You look sad to me, Alicia.
No. Why should I try to pretend with you? You're just too smart, you know? I am feeling bad.
How come? Is something wrong between you and Detective Reed?
No. Bob and I aren't seeing each other very much right now, but it's only because we're working hard. No, it's not Bob. It's just that I think someone has lied to me.
That happens sometimes.
You know you're so grown up. No, it's Bob's sister, Delia.
Delia? I thought you liked her.
I did. I mean, sometimes I still do. She was so nice to me when I was in trouble.
The money I say you took, right?
That's right. She called her brother and...
No wonder you liked her.
No. She really went out of her way to help me, but, I mean, lately she is so different. It's maybe a side I've never seen before.
How do you mean?
You feel okay? You don't mind listening?
Yeah, I got a lot of time, remember?
Okay. Oh, when I first met Delia, she was very sad and in a lot of trouble.
What kind of trouble?
Well, she was sick, and she was very, very scared. So I tried to help. Dr. Coleridge.
Excuse me, I didn't want to interrupt. I believe you were talking about our mutual friend, Mrs. Brown. Oh, don't worry, actually, I came by to talk with Angel.
What about?
Well, I wanted you to know in advance that there's going to be a strike here by some of the doctors.
Oh, yeah, I heard they were having trouble with the hospital.
Some of them have their differences with the administration, but I wanted you to know that I expect to be working here, and I'm going to make it a point to check on you regularly.
It's very nice of you, Dr. Coleridge.
My pleasure. Besides, I enjoy looking after our star patient. So don't worry, okay?
Okay, thanks.
And don't you forget, I'm going to be here, too. You know, every day. I better get back on duty, okay?
Okay.
Do you need anything now, Angel?
Oh, no, thanks. I'll take a little nap now.
Okay, I'll see you later.
Take care.
Bye.
Would you like to elaborate on that story, Mrs. Brown?
I don't know you're Mrs. Brown, Doctor.
I'm quite sure that you do.
Spend breakfast in bed with SoapNet. Sleep in, curl up, and check out. With back-to-back episodes of One Tree Hill and Beverly Hills 90210. Breakfast in bed, 7 to 12 noon every Saturday and Sunday morning on SoapNet.